There are very simple signs that might be happening to you every day. But the truth is, these signs could be the first indication that your kidneys are in danger. And the worst part is, most people don't discover this until it's very late. In this video, I'll tell you about 10 warning signs and when you should really worry before it's too late. I'm Dr. Osama Ibrahim, a kidney disease specialist. And let's understand the topic simply. The kidneys are a very important and vital organ in your body. They're responsible for filtering toxins and excess fluids from the blood. They are also responsible for regulating blood pressure. But the big problem is that when kidney failure starts, it starts silently. What does silently mean, doctor? Meaning without any clear symptoms at first. And that's why you must be very aware of the signs we're about to mention. And you'll be surprised that many of these signs happen to us daily, and we might not notice them, especially sign number 7 and sign number 8. Make sure to watch the video to the end because these signs are vital for your life and health. First sign is constant fatigue. What does constant fatigue mean? It means feeling tired all the time without effort, even if you're getting enough hours of sleep. But you feel like you haven't slept well and you're always tired. This is due to toxin buildup in the blood from kidney weakness or deteriorating kidney health, especially if you have diabetes or high blood pressure. The second sign is swelling under the eyelids, in the hands and in the feet. Why does this happen? Because as we said, the kidneys are responsible for removing excess water through urine. When the kidneys weaken, their efficiency decreases. This water or fluid builds up under the skin, appearing in the hands, legs and eyelids, especially puffiness under the eyes. This is most noticeable right after the patient wakes up. The third sign is changes in urination, like an increase or decrease in frequency. Foamy urine. What does foamy urine mean? It means there's foam, like bubbles on soap or in carbonated drinks. We've made a very important video about the difference when foamy urine is normal and when it's a cause for concern. I'll leave the link in the description or it'll appear in the iCard above. I recommend watching it after this video. It's very important as many people ask about foamy urine and how to tell if it's dangerous. Also, having dark-colored urine or blood in the urine. These are signs that should alert us to potential kidney problems. Sign number 4 is shortness of breath. A patient might suddenly feel like they're gasping for air and can't breathe properly. This happens simply due to fluid buildup, including in the lungs, which reduces the patient's ability to breathe normally. Now for a well-known and very strange sign, unfortunately, many people overlook it: persistent itching or scratching. Many patients experience persistent itching and take various antihistamines, and in the end, the situation doesn't improve. And usually the reason is that if he has kidney failure, the kidneys are severely affected and toxins start to build up, especially since the kidneys are responsible for regulating phosphorus and calcium. So when phosphorus levels rise, it causes itching and scratching for the patient. And this is one of the signs that, unfortunately, many people don't notice. And it's one of the early signs of kidney failure occurring. Before we continue with the rest of the warning signs, if you feel you've benefited from this video, please like it and let's continue. Sign number 6 is a metallic taste while eating. What does that mean? It means when you eat, you feel a taste like metal. Water tastes bad. Food starts to taste bad. This is evidence that the kidneys are affected and toxins are increasing in the body. And this is what gives you that metallic or ammonia-like taste. Also, a loss of appetite can occur because the food tastes bad. So the patient refuses to eat. Persistent loss of appetite. Sign number 7 is, of course, high blood pressure because the kidney is responsible for regulating blood pressure in the body. And kidney injury or failure leads to high blood pressure. Sign number 8 is persistent nausea, vomiting, and a feeling of wanting to throw up. This is also due to the high level of toxins in the blood, regulated by the kidneys. Sign number 9, and this is also one of the strange signs, poor sleep quality or persistent insomnia. The buildup of toxins in the blood can cause you to wake up frequently, leading to very poor sleep quality. The final sign is muscle cramps. We've previously agreed in videos about the kidneys that they are responsible for regulating calcium and phosphorus, as well as regulating potassium. Any impairment in kidney function disrupts this mineral regulation, leading to persistent cramping. But the important distinction you must know is that there are 2 types of kidney failure: acute or temporary kidney failure and chronic kidney failure. So what is the difference? Acute kidney failure happens suddenly and is usually the result of a specific cause. A decline in kidney function in a patient due to an event like dehydration, for example, leads to elevated kidney levels. This leads to acute kidney failure. Unfortunately, if we treat the cause early, the kidney returns to normal or its baseline. The problem is with chronic kidney failure, which occurs gradually, meaning the patient has a decline in kidney function that progresses over time, especially if they have diabetes or hypertension, resulting in permanent kidney failure that often eventually requires dialysis or a kidney transplant later on. This is what must be detected early to minimize reaching this stage so the patient doesn't end up needing dialysis. So when should you see a doctor immediately? If any of these signs appear, if you have kidney dysfunction and one of these signs shows up, you must see a doctor right away. First, persistent vomiting that won't stop. 2, severe swelling in the hands or feet. A noticeable decrease in urine, meaning the daily amount of urine has dropped significantly and might be close to stopping. Constant fatigue without any apparent reason. Now, let me tell you about the most dangerous things that can destroy the kidneys. And the scary part is that many people do them daily without realizing it. First, the excessive use of painkillers. The most common hidden cause is taking painkillers like NSAIDs frequently. They can reduce blood flow to the kidneys, and over time, they can cause permanent damage. If you take painkillers daily, you must consult your doctor. Second, chronic dehydration. Not drinking enough water puts the kidneys under constant stress, which can lead to toxin buildup and eventually impaired function. Number 3, diabetes, especially when it's uncontrolled. This is the leading cause of kidney failure worldwide, particularly in America. High blood sugar over long periods damages the small blood vessels in the kidneys. The fourth cause is high blood pressure. High pressure strains the kidneys themselves and can destroy them gradually without clear symptoms. Number 5, unregulated supplements and herbs. Some people take excessive protein, herbs, or gym supplements without medical supervision. This can severely strain the kidneys, especially if you're predisposed or have a family history. Number 6, holding urine for long periods. A simple but dangerous habit. It can cause infections and affect the kidneys over time. The problem isn't just the causes. The issue is that kidneys can be damaged for a long time without showing any clear symptoms. If you have any of the signs we mentioned or practice any of these habits constantly, you must check your kidneys early. Simple tests like creatinine and urine analysis can save your life. Always remember, the simplest symptom like itching could be a message from your body that there's a bigger problem. Finally, a piece of advice. The kidney can be damaged in silence, but your body always sends signals. Will you notice this early and intervene and treat it, or will you wait and say it's normal until it's too late? If you want to protect your kidneys and want to know the most important tests you need to monitor kidney function, follow us on our channel and subscribe now to follow all the upcoming episodes. And don't forget, we made this video for you today with good intentions. I also hope you've done something good today and always make it a habit. Like, share, and benefit others. And I'll see you next week to check on you and reassure you. Stay safe.